Another West Australian is getting hospital treatment for the potentially deadly meningococcal disease W strain. So far this year, 14 people have contracted the illness, specifically the W, B and Y strains. Let's bring in Dr. Tamara Hunter. Hi, Dr. Hunter.
Hi, Tracy.
This is a frightening disease. Its symptoms can often be mistaken for the flu.
Yes, meningococcal is actually a bacteria that colonises around about 10 to 20% of people. It actually lives in the tissues at the back of the nose and the throat. Now, it's not easily transferable to others. It doesn't live in the saliva. You can only transfer it if you cough or sneeze on somebody. And it doesn't exist in the environment very easily. But when it becomes invasive, when it gets into the bloodstream and ultimately to the tissues that surround the spinal cord and the brain, it can be very serious. And you're absolutely right, Tracy. Most of the initial symptoms are very similar to the flu: high fevers, chills, sometimes a cough. A little bit more concerning if people start to complain of neck stiffness or drowsiness, nausea and vomiting, and even more concerning in young children if they develop a rash or lethargy.
Yeah, OK. Well, we're seeing more and more cases of this disease. Which age group is most susceptible?
Definitely young children. Babies and young children are most susceptible, but there is also an increasing peak in adults over the age of 60, particularly with these more virulent strains of W and Y.
Meningococcal has a range of strains. You just mentioned a couple there. Are there vaccinations for all of them?
There are. Meningococcal is actually responsive to antibiotic treatment, but there are vaccinations. We know that there is a routine vaccination available for the C serogroup for all children at 12 months of age, and there is also vaccination schedule arrangement for adolescents and children for a group of 4, which include the A, the C, the W and the Y. So it's best to sit with your GP and talk about what options you have.
Or how else can we protect ourselves from meningococcal?
Yeah, so it is responsive to antibiotics. It is a bacteria that will progress very quickly once it becomes invasive. So if you are experiencing these symptoms, it's important to see your doctor as soon as possible to see if in fact it is a meningococcal infection. So treatment with antibiotics, protection with vaccinations. So it is a notifiable disease and the Department of Health will contact all people who've been in contact with someone with meningococcal disease and we'll offer them either antibiotics or vaccination.
All right, good to know. Dr. Tamara Hunter, thank you very much.